Good evening, Wendy, and thank you very much for joining us here at the Mint to talk about your work and career.
Thank you so much. Thank you for the warm welcome, Henry, and it's nice to be here.
Brilliant. Well, maybe, Wendy, you could start by explaining what your profession is and how you gain the skills that you use in your job.
Okay, so I am a social and behavior change practitioner, and I also do community development. And what I did at campus gave me a very good background into what I am doing right now. So at campus, I did sociology and social administration and a bit of gender. And that gave me a background into, just being able to work with the communities, with the different communities, being able to understand that people's behaviors are shaped by different things. That is the background in which they live, the cultural beliefs, the education level. So that gave me a very good background into just understanding what different people in different societies really value, and how that affects behavior. And so what I do right now is social and behavior change, especially in the health sector. So we work mostly with the communities in both rural and urban areas, and we identify who our target audience are, and just study them in terms of what are their cultural backgrounds, what are their beliefs, what is it that they really hold dear to them that affects either positive or negative behavior. And so what is important for us is to be able to understand who our target audience is first before we
Okay,
even agree with them what the behavior is.
brilliant. So
Yeah.
that sounds fascinating. And can you give me a specific example of a community you've worked with, where they live, the conditions in which they live, what the sort of cultural background and so forth that you're engaging with?
Good. So the one thing what I want to tell you, Henry, is that I have worked with very many communities in Kenya, and so I will give you an example of a community called the Kambas that are based in Kitui in the eastern part of Kenya. One of the things we were doing there was programs on family planning, and water and hygiene and sanitation. And so it was very interesting for us because part of the things that was really hindering the uptake of good behavior for them was their religious beliefs. They have a sect group called Kavonocha. And so for Kavonocha, what they believe is you're not supposed to go to seek help in a health facility. So you're not supposed to go for family planning. If you get hurt, for example, today, you're not supposed to go to a health facility, because when you go to a health facility, then you are sinning. That is a sin. You're going against God's rules. And so for them, what they believe is if you die because it has been planned that you will die that day. So you're not supposed to seek any help from a health practitioner, because then if you do that, then you will be excommunicated from that particular religious group. And so it was very interesting for us to just go and talk to them. And for us, we believe that behavior change does not take a day. Behavior change is something that takes some time. So it requires that you talk to the people about the kind of behavior you want them to adopt. And so we had very meaningful conversations with them. And what we are happy about is that by the time the project was coming to an end, we had a few of them going to deliver in health facilities, because then they understood the dangers of not delivering in health facilities. so
But
so
yeah, I was just wondering because this phenomenon of religious sects who
Yes.
believe that various things shouldn't be have their bodies interfered with or whatever, or they shouldn't be treated in certain ways is widespread, isn't it? And usually in those circumstances, as you say, you might be excommunicated, and that is so disastrous
Hmm.
that I would have expected no one to have talked to you, let alone done anything, because presumably they might get marked as potential people who would, disobey the rules of their group. How was it? How was it they were willing to talk to you and willing to change, given the risks to them of being thrown out of their communities, which would be presumably a disaster?
One of the things that we realized in programming, especially for that particular program, is one of the things that you have to do, even as you get into a particular community that you want to work with, is the involvement of the leaders. And
Right.
so, what we did at the beginning was to involve all religious leaders, and that included the religious leaders of that particular sect group. And so they came into a meeting, despite the fact that even in that particular meeting, they were sort of, there was that sort of discrimination from the other religious leaders, because the other religious leaders know the practices of this particular sect group. And so, yes, so that was the first thing that we did, identifying that for us to move forward, there are people that we need to bring on board. So that religious leaders meeting really gave us a good entry point into all the religious groups that we were going to work with. And so from them, we just singled out who in this religious sect group do we need to work with closely, so that they're even able to mobilize their people. And I can tell you for sure, that particular sect group, the members of that group are very friendly. The only thing they will make you understand is for you to appreciate their beliefs, so that you're not forcing them. So as I told you before, is yes, we identified who the leaders are, who the most influential people are, and we told them what we are going to tell them, and we're not going to coerce them to take up any behavior. So yeah, so it wasn't very easy, but I think in any when you're doing social behavior change programming, then you need to identify who are the key people that will help you to enter into a community that you want to work with moving forward.
And did the leaders of the sect in question give permission to the people in the sect to talk to you? I mean, was there any change in their view on not allowing people to go and get treatment?
Hmm. Come
Did
again,
they change?
Henry.
Sorry?
I beg your pardon on that.
Well, I was just wondering whether the leaders of the sect
Hmm.
gave permission
Hmm.
to their people in their church
Hmm.
to talk to you and have and get treatment.
They gave us permission to talk to the people, and we used that opportunity. You know what they normally say is, as a behavior change practitioner, is when you're talking to people, you need to identify at what point of behavior change a particular person is. So yes, they gave us permission to talk to their members. The only thing is that they also had to sit there and listen to what we are telling their people. So
They
they
had
gave us the
sorry, they had to what?
I'm saying that the only thing they did is they insisted on them being present in that meeting.
Ah, okay.
Yes,
So
so that they know the kind of information we are giving to their people. That was
okay.
very key for them.
So they were present, and how did
Yes, they
they
were present.
and did they seek to influence or give, remind people that if they were ill, that was a judgment of God or whatever?
No, for them it's very interesting, because for them they stuck to what they believe. And even when they were giving us permission, they were very clear on the fact that please do not come and coerce people, do not come and force people to take up the behavior. We will listen to you, but that doesn't mean that we are going to follow your ways. And so for us as behavior change practitioners, what was exciting is that we were given that forum to talk to the people, because then that is the first step of behavior change. For me to be able to give you information, and more information and more information, and eventually you will make a decision on what you want to do with that information.
But the people who did take steps and
Yes.
get treatment, were they excommunicated?
They were not excommunicated. So what we did is, what happened is they came to talk to us on the sides. That is, after the meeting with the larger group, those who seemed interested and those who wanted to be converted came to talk to us on the side. And so, what happened eventually is for us to be even to be able to talk to the health practitioners, so that they also know that these people will come, and they will come secretly. They do not want to be seen coming for health services.
Oh, right. So you were
Yes.
basically having people coming to you secretly, so to avoid
Yes.
the danger of them being excommunicated.
Yes. So again, for us it is very important to be able to appreciate that these are not people who want to leave their sect group, but they, on the other hand, they are interested in getting more information about the things that we are talking about. So, for example, we were telling them, if a pregnant woman, who is due for delivery, for example, bleeds so much, it means that you're going to die. And that means you will leave your children. So, what does that mean? It means you need to go and deliver in a health facility.
Okay, so you're yet to have you seen people going subsequently to health facilities from this
Oh
sect?
yes, we saw that.
Okay, and so did
They
you
went,
keep that?
and I can give you examples. They went to deliver in health facilities, or rather, some of them requested the health practitioners to help them deliver in secretive places. So long as your child is being delivered by a health practitioner. The other interesting bit was on immunization, because even initially they never used to take their kids for immunization. But then what happened is they used to talk to the health practitioner, so the health practitioner can do that in a place where they cannot be seen by their fellow sect members.
Wow.
So for us,
Okay,
we were saying at the end of the day, that is behavior change. Someone has shifted from what they never used to do to what they do, which is desirable behavior.
that's really interesting. And I suppose it'll be very interesting to see in the medium term whether that affects the beliefs or whether the leaders will turn a blind eye, because presumably
Yeah,
someone could report them, or it could get out what they've done, but but maybe in the interest of the leaders to sort of let it happen undercover so that they still are supporting things on the front. There can be a lot of
yeah,
hypocrisy in these
yeah,
situations, can't there?
yeah.
Blimey. So that's a fascinating example. So can you give me another example? Because obviously that this particular sect is quite peculiar, I would imagine, that unusual. So can you give me other examples of the challenges in different communities that you've found, and how you've dealt with them?
I think the other challenge we faced was, like, for example, if I may speak about family planning, uptake of family planning, because then that is what I have done for a long period of time. So if I may talk about uptake of family planning, the other challenge has been getting support from the male partners,
Right.
because male partners have a lot of beliefs on family planning, on the methods. So they have these myths and misconceptions that they really, really believe in. So it becomes very difficult for you to change their mindset. But what we did to counter that was to engage the engagement and male involvement in our community engagement sessions. So what we did was to have male only groups and just ask them, what is the problem? Why don't you think your women should go for family planning? And they gave you all sorts of reasons. And so from those, because one of the things they say is you need to understand where the problem is and then find a solution together. And so we had those discussions with the males, and we had male champions, and male champions in this case, people who have practiced the behavior that is desirable. So we also
Can you
had
give
male
me
champions.
can you give me a specific example of the sort of behavior that you were wanting to be practiced, and the reasons why men didn't want to do that
So I was talking about family planning, and
within family planning? Was it use of
yes,
condoms, or
just encouraging their women to go for, for family planning, you can't choose for someone to either take up a short term or a long term family planning. So for us as a program, it was just about promoting family planning methods. So the males, most of the spouses are not comfortable encouraging their women to go for any family planning method, even condom use.
oh, right. So because what that means that they won't become pregnant, they actually want as many children as possible. Is this the
Yes, number one is that. Number one is, in the African setting, the more the children, the the wealthier you are. Yeah.
right?
Oh yes. So for most men, and part of the questions they ask their women, the main reason you got married to me is to give me children. So why would
Okay.
you then go for family planning?
Oh, right. So it's a betrayal of the deal, effectively, the marriage
Oh yes. Oh
agreement,
yes.
effectively.
And it is rooted in the culture, because in the African setting, you're supposed to have very many children. It doesn't
Right.
matter that you can't take care of them.
So it's about the principle of family planning. How do if this is a fundamental belief about status of men in Africa, how do you go about addressing that? What sort of conversations can you have, or that can actually affect how men think about that?
So number one is to look at it from so what we used to do is to engage the males through small group sessions mostly. So it's just a group of men, of course, within the same age, within the same economic groups. So have those discussions. And number one for us is to identify where the problem is. I mean, what are these things that you really believe in that are affecting your mindset about family planning methods, and why you shouldn't support your wives to take up the family planning methods. So yeah, so after you understand what the problem is, then it is to give as much information as possible. And part of the things we were doing was to look at it from an economic point of view. So for
Okay.
example, if you have 8 children, and these are just discussions, very candid discussions that we have with them. So for example, if you have 8 children, with the current economy, are you even able to give them the best education, that kind of education that you'd want your kids to have? That is number one. And then to also look at it from the health perspective, because we make them understand that the more a woman gives birth, the riskier it is for her. So then that translates into maternal deaths and neonatal deaths. So we make them look at it from all those perspectives. And so at the end of the day, there is always a call to action. So what have we agreed we are going to do? Are you going to support your woman? Are you going to walk your woman to a health facility to look for a family planning method and such things?
And do you get people then to sort of, yeah, if they make a commitment, do you check whether they've fulfilled their commitment? Does the group monitor who fulfills the commitment?
Okay, so what used to happen, we used to work with we used to meet our target audiences in groups. So for example, a group of, I don't know if you know boda are the bicycle riders,
Okay.
the motorcycle riders. So you meet them in groups, but then you also refer them. So there was the aspect of referring them to the health facilities that we used to work closely with. So there's that aspect of referral then helps us to know that this particular, because when they get to the health facility, then they will be asked, where did you get this information? How did you come to know about family planning? How did you come to know about this health facility? So there is the background information that the health practitioner picks from that particular person when they go to that health facility.
Okay. And does that
Yeah.
allow you to know how effective you've been?
To some extent, yes, but other times no, because again, it becomes difficult for you to track everyone
Yeah.
who decides to take up the behavior. But for some, we can attribute to, like, we can easily attribute that to the kind of information that we gave them, because we also used to work with community health volunteers who then have the responsibility of doing follow-ups. After those kind of discussions, then we have a community health volunteer, both males and females, who do follow up and just ensure that someone is doing what they promised to do during the declarations.
Okay. And
Yeah.
we were talking about in the last example how you get leading people on board. That was slightly different in that you just to get permission, they weren't actually going to change anything. But presumably you could find influential people in the community who could put your message out
Yes.
about the economics and the benefits. And, have you been doing that?
Oh, yes. So, as I mentioned, part of the reasons we decided to use the religious leaders is because I will take you back. We do participatory approaches. So even when you're deciding what it is that you want to implement in the community, you sit with the community members and agree, what do you think is going to work in this community? Where do you
Okay.
even think, who do we need to talk to? So part of the things that were coming out clearly is, for example, women were saying, if you send a religious leader to me, I will listen to them more than any other person.
Okay.
So part of the things that we were asking them, who do you think is your greatest influencer within your community? Who is your greatest influencer? And they will tell you. So they told us the religious leaders, they told us their own peers. So for example, most women will go for family planning methods because their friend went for that family planning method.
Right.
Yes. And
And
so
have you
they identified the different people that if those people went to talk to them, if those people went to give them some sort of education about family planning methods, about cervical cancer screening, about immunization, then they would listen to them more than if a stranger just came and talked to them.
right.
Oh yeah.
And do you monitor at all how the overall attitudes change in communities? Because you were saying to start with this general belief amongst African men that more children is better. Do
Mhm.
you do some monitoring how that general belief, whether that general belief is changing over?
So part of the things we do, like for example, when we were doing the small group sessions that I have talked to you about, what we did was to what we did and we still do is to talk to the same group several times. So with time, then you will get to know, are these people the same people that I met in the first place? So, for example, if you were to meet a group of women, because women in the African setup have their own, small organizations where they come and meet frequently. So, if
Okay.
I went there this month, then I will go there maybe after 2 months and talk about the same topic. So it is not just exposing them to that particular topic or exposing them to that particular discussion once. You go there several times, and with time, then you will see if there is change in attitudes and change in beliefs. But also, since we work directly with health facilities, then some of it then translates into uptake of the particular behavior that you want to promote. So we look at various things to just help us know that there is a change in attitude.
Can you give me any other examples of work you've done apart from family planning and the issues that have arisen there?
Okay, so initially I used to work for an organization that was church based, and we still used to work with community groups. So our role was to build capacity of those particular groups, and building capacity was in areas of food security.
Okay.
So yeah, so you understand that a lot of communities in Kenya, not everyone has a big piece of land where they can do farming, and the sort of farming that will give you enough food to sustain you throughout the year until the next harvest. So one of the pillars was food security. So just
Okay.
looking at the different people in their groups, and most of them are farmers. So again, it just starts from problem identification. What is the problem? That I have a piece of land that cannot give me adequate food. So in most cases, whatever you harvest will only last you for say 2 3 months. And
Two
after
or
two
three
three
months
months,
out of 12. That's not a lot, is it?
that's not so much. And remember, these are people with families. So after 2 3 months, then that means someone has to start buying food.
Right.
So what we used to do was to identify then why is your farm not giving you enough food for you to be able to feed your family throughout the year, and even get a little bit more for you to be able to sell and get a few coins.
Okay.
So pillar number one was food security. So linking them to the various ministries within the country, so that they are able to get fertilizer at subsidized rates, so that they are able to be trained on how to just use the locally available material to ensure that their farm is producing more in case there is free fertilizer, and then they were able to get. So number one was linkages, number two was training. So for them to be able to just ensure that they have better produce out of their farms. Then number two was, yes.
Well, I was just wondering because you were saying that the moment the food lasts about 2 or 3 months,
Mm-hmm.
I mean, to get enough food out of the same bit of land for 4 times, for a whole year, that is a huge change
Yes.
in productivity, isn't it? I mean, you would think it's very unlikely, even with a bit of fertilizer, etc., that you
Mm-hmm.
can produce 4 times the amount of
Mm-hmm.
food on a bit of land.
Mm-hmm. So Henry, this is how we looked at it, and I am glad that even by the time I was leaving that organization, two or three of the farmers were calling me and telling me, you really helped us. So we were looking at this from this perspective. Number one, is it the plants that you're putting on your farm? So like where I come from, that is in western part of Kenya. So many farmers believe in planting maize, and so maize will take a very long time. So by the time you harvest, that's like 6 months wasted, and you're waiting for say one bag, or a 90 kg bag of maize, that will not sustain your family. So number one was to just try and change their mindsets through interactions with the different experts in the agricultural sector. So
Okay.
changing their mindsets in terms of it doesn't have to be maize. You can do vegetables, and vegetables will take a shorter time, and what you will get from the vegetables will allow you to buy food for your family. And that food even includes maize that you really insist on planting, and it doesn't give you a lot of produce.
Wow. So
That
did
is
you
number one.
actually,
Number two is,
yeah.
how do you even plan your farm? How do you even plan it? Are you putting maize on the entire farm, or are you saying this particular portion, maybe a quarter of it I will put maize, a quarter I will put beans, a quarter I will put vegetables, and then I will be able to sell the vegetables and buy other things and even pay school fees for my children. So number one is just changing the mindset, because there are things you really believe, you really think it has to be maize, but that is not the thing.
And these farmers would listen to experts.
Oh yes.
That's
And
interesting.
the good thing is that those experts, most of them live within those societies. So there are people they
Okay.
interact with daily. The problem is most communities don't even know that these experts are within them, or those experts are put there to help them.
Okay, so you're really just connecting people, and as they're local, they don't seem like they're strangers, or they'll listen to them.
Yeah, so in most cases, you don't get someone from outside that particular area. You get someone who comes from within that area. So in most cases, these are people they interact with in funerals, in functions, and what, but they don't know that they can tap into the strengths of that person to help them. Our biggest bit was to just link you to the people who are going to help you to get you from this level to the next level.
And were they able to go and visit farms that were doing multiple, growing lots of different things? And
Oh yes. So what they used to do is to come. So for example, if you have met a group of men, maybe they sit together. They have what we call chamas. For example, they come together and contribute money to support one another. So you will say, for example, that for practical sessions, we are going to so, and maybe we're going to Henry's piece of land. That is where we will do our practicals. And so this particular expert, we call them that particular expert, will keep going to that particular piece of land and meeting the same group of people to just ensure that they are doing the things that they agreed to do.
brilliant.
Oh
Well, that's
yes.
absolutely fascinating. Can you just tell me, to as a final thing, I just wonder, what do you find most worthwhile and most, what makes you feel best about the job you do?
I think for me, it's just being able to realize, I mean, the most fulfilling part of my work is to be able to, just get someone from a particular level that you found them to a desirable level, that level that you are proud of. So for example, if I've given you an example of the farmers. So if you found them, getting this little, and they even call you to just give you feedback and tell them and telling you, the kind of training that I received has made me a very good farmer, for example. In the health sector, it is just about trying to change the mindsets of people and appreciating that it will take a long time. So, going back to the same people and just listening to them talk, and some of those people that you found practicing the behavior that is not desirable, being champions, being the ones that are championing the positive behavior, for me that is very fulfilling.
Brilliant. Well,
Yes.
thank you very much for giving us your time to talk about your work, which does
Mhm.
sound incredibly exciting and worthwhile.
Thank
Uh,
you.
and so, thank you and goodbye for the moment.